Now we will know how to read ECG paper. First of all, we have to remember our graph ECG, lead 1, lead 2, 3, AVR, AVL, AVF, V1, 2, 3, 4, 5, 6. We know that in figure wall of the heart refer to lead 2, 3, AVF, bilateral wall 1, AVL, and septal is V1, V2, strict anterior V3, V4, and low lateral V5 and V6. Where to look and what we see? That's our question. First of all, we have to make a spot diagnosis of these leads, just to know any abnormality of the waves or amplitude, duration, just general look. Second, we have to follow the scheme. The scheme consists of two components. First of all is where to look, lead 2, leads this, and what we see, or what we look for. We look at the lead 2 and look for block, AV block, arrhythmia, atrial enlargement. We look at V12 as a right part of the heart and V5, V6 as a left part of the heart. 2C, leg 4, bundle branch block and ventricular enlargement. We look at lead 1 and AVF to know or detect the axis. We look at the walls, inferior wall, high lateral wall, lateral wall, to look for ischemia or infarction. We look for the others, digitalis or hyperkalemia or low voltage. This scheme need to detect or find it repeated with regular repetition. Okay, you can't look for this before this. No, you have to make this number 1, this number 2, this number 3 as follows. Okay, first of all we will look at the lead 2. Lead 2 is the key of the ECG paper. Our key is lead 2. We look for AV block. What types of block we have or may we can find in lead 2. AV block. What is the problem? The problem here is that we know that it's a node, AV node, bundle first right and left node. The problem is in AV node. AV node may have a problem. There is a delay in the conduction. Delay conduction refer delay in duration. You know the QR is complex, and this is referred by PR interval. The problem here in PR interval. PR interval normally between 3 to 5 small cubics. So if it's more than 5 small cubics, we have here a problem in AV. There's AV block. There are types of AV block. Number 1, we have AV block type 1 AV block. Type 1 AV block, you have normal ECG, but it's problem in PR interval. PR interval is more than 5 small cubics. This is an increase in duration. This is type 1 AV block. P wave followed by PRS complex, but the problem in the conduction. There is delay. This is type 1 AV block. What about type 2 AV block? Type 2 AV block, there is a subtype called type A or type B. I mean that Mobitz type 1 or Mobitz type 2. Mobitz type 1 called Wenckbach. Wenckbach. What's meant by Wenckbach? Wenckbach, there is a ischemia in AV node, and you know this this increase in PR interval, but regularly. You know that P wave, PRS complex, P wave, PRS complex, P wave, PRS complex. PR interval here is let's suppose it's 4, and we have PR interval 5, we have PR interval 6, then 7, then a drop. When you see this, then a drop in the wave. The exhaustion, it's conduction. The conduction is a node, AV node, and slow in conduction slow, increase, ischemia increase, and suddenly there's a drop in the conduction. This is called type 1, morbid type 1 of the AV block, second degree. Morbid type 2, it is dangerous. Morbid type 2, you see that P wave, URS complex, and suddenly loss of the wave. There is a loss. Then the others. This loss comes suddenly, not regularly like Wenkebach, just sudden loss of the beat here. This is called morbid type 2. AV block, third degree, I mean complete heart block. Complete heart block, what you see in complete heart block. This is a complete block of the AV wave. So the atrium contract with its own rhythm with SA node, its pacemaker, and the ventricle contract with its own pacemaker of the ventricle separately. There is complete dissociation between the atrium and the ventricle. So the waves, you see, this is a regular waves of the P wave, regular, and the ventricle with regularity, but no relation. You can see P wave here, P wave here, P wave here, any wave, P wave, but between the P and P there is a regularity. And the ventricle make its characteristic QRS complex like this. Okay, this is the heart block. So I look at the lead 2 and check PR interval to see if there is any block, any delay in conduction of the PR. So what can I see also in lead 2? I can see arrhythmia. Arrhythmia, I mean, first, before I detect arrhythmia, I have to check our rate and to get our rhythm and to know our pacemaker. Rate 300 over RR interval. How can I get? You know this QRS complex, and this is three large cubics. 300 over 3 large cubics, 100 beat per minute, over 1,000 and a half over R interval with a small cubics. I mean this is 15 small cubics, 150, 1 beat per minute also. This is heart rate. Rhythm, we have types of rhythm. It may be regular, may be irregular, and the irregular may be regular, irregular, or irregular irregularity. I mean regular means this is the RR is equal to each other. This is distance equal to this distance, and irregular, this is no equality, but it may be a regular irregularity. I mean this abnormal relation shape, this abnormal shape repeats with the same pattern. This is irregular, this is regular irregularity, or irregular irregularity. I mean this is a irregularity at all. So and we have a pacemaker. The pacemaker here, let's say we have a sinus pacing, or maybe atrial, or maybe junctional, or maybe ventricular. Sinus, the pacemaker is SA node between 60 to 100. If it's over, this is called tachycardia. If it's down 60, it's called bradycardia. Okay. Atrial, the focus that sends impulses pacemaker is out of SA node, but found in atrium. So it's a make tachycardia over 150. It may be AF, atrial fibrillation, or atrial flutter. Atrial fibrillation, you see P wave is fibrillatory like this, or atrial flutter is a flutter wave, so this appears. Okay, it may be junctional. The pacemaker here is AV node. You can find it you can find absent P wave, but there is a QRS complex. Absent P wave refer to junctional rhythm. or maybe ventricular. You see that characteristic here is complex. This is a ventricular, maybe ventricular tachycardia or ventricular fibrillation. Most of us need DC shock to make it come to the normal again, to restore the rhythm. Okay.